Good afternoon and thank you for joining us. My name is Tina Thibault and I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. So today we are reporting 5 new cases in the central zone. All but one can be traced, and that's under investigation. Our hospitalizations have come way down. We now have 3 people in hospital and 1 in ICU. I know it isn't always easy, but we are in a strong position, and that's thanks to all of you for following the public health restrictions and protocols. And thanks for getting vaccinated. We are now ahead of every province on our first dose delivery. Thank you to the medical teams and the volunteers for working so hard to provide vaccines, and to all of you for getting your vaccines. If you have not yet received your first dose, we are ramping up our clinics. Our clinic opened today at the Nova Centre in Halifax for people with appointments, and it will be running today and tomorrow and Saturday. But on Tuesday, we will start taking walk-in appointments, and we are encouraging anyone who has not had their first dose to please walk in, and no appointment necessary. We're also opening more community clinics, extending hours in current clinics, and expanding capacity at our drive-through clinics. More appointments will be made available for first dose and second dose, so if you have not yet booked an appointment, please do so. We are building our immunity against COVID and the potential variants of concern, especially the Delta variant that we spoke about a lot. So we are not there yet. That's why Dr. Strang and his team asked for 1 more week before we open ourselves to the rest of the country, now 6 days. And because New Brunswick has already done that, we have to wait just a few more days to open up to our neighbor. Many of you showed your frustration by blocking our border, causing disruption to our healthcare system and our economy. It's a shame it had to come to that. I understand that it is hard to be away from a family for so long, and I understand that you are anxious to see loved ones, but we are asking for a week. That's a week some families will never get back because they lost a loved one to COVID complications. And Dr. Strang will provide more details, but what he's looking for is stronger second dose coverage for those in our province that are over the age of 65. We need more people in that age group to get their second dose. 1 more week will get us there, and again, that's 6 days from today. So on June 30th, New Brunswickers can come and go freely into Nova Scotia, and Nova Scotians can do the same in that province. Also on June 30th, we are scheduled to open up in Phase 3, opening to the rest of the country with modified isolation requirements. So for anyone coming in from outside of the Atlantic region, you will have to fill out a safe check-in form and show the proof of vaccine. Again, those with 2 doses, you can enter. This is actually a small change. We're not requiring a test anymore, so we're aligning with the federal government's policy as of July 5th that they announced. So as of today, if you have 2 doses of vaccine when you come into our province, there's no longer a requirement for a test. Previously, we were requiring having that 1 test and waiting in isolation until you receive that negative test outcome. But now if you have 2 doses of vaccine and 14 days had passed, you can come into this province and it does not require a test. We recommend testing as we do for all people. With 1 dose, you still need to isolate for 7 days and have those 2 negative tests. And for anyone without a vaccine, you will need to isolate for the 14 days. So it's been a tough couple of days, Dr. Strang, but I believe we are getting there, and I want to thank you and your team personally for continuing to provide the best available advice based on science, and we'll continue to follow that. And I'll turn it over to you.
Thank you, Premier, and good afternoon, everybody. All our indicators continue to trend in the right direction. Cases are declining and vaccine coverage is increasing. Our testing numbers remain steady. We're watching these numbers closely as we move through our reopening plan and loosen restrictions. It has been a tense couple of days. The situation at the New Brunswick-Nova Scotia border was troubling. I'm glad it ended peacefully and no one was hurt. In the past 16 months, we've had to make some very difficult, sometimes unpopular decisions. Decisions that have significant impacts on people, families, and businesses. But those decisions are always made with the best interests of all Nova Scotians in mind. I have had sleepless nights, and I do feel people's frustration at this pandemic. and the sacrifices we've all had to make to control it. And I know you are tired and just want this to be over. But ultimately, I have to make recommendations based on the available science while considering acceptable risk and what is best for everyone's health and safety. And some of that means, when we talk about everyone, some of that means compromising for some people so we can do what's best for when we look at everybody as a collective. We need one more week before we can open the border to our New Brunswick neighbors. One more week to watch cases in New Brunswick and assess the situation after their border has been open for a full 2 weeks. One more week to get Nova Scotians over 65 closer to the double vaccination target of at least 75%. And one more week to get closer or even meet the target of at least 75% of all Nova Scotians with at least one dose of vaccine. With all these necessary protections in place for Nova Scotia, on June 30th, we can open to New Brunswick without restrictions. If you are planning to go to New Brunswick before June 30th, you will need to quarantine based on how many doses of vaccine you have had, but you can end your quarantine on June the 30th. So on June 30th, New Brunswickers can join travelers from PEI and Newfoundland in coming and going freely into Nova Scotia, and Nova Scotians can do the same in those 3 provinces. We will not be requiring residents of Atlantic Canada to complete the online safe check-in form unless they have traveled outside of Atlantic Canada. If you live in Nova Scotia or another Atlantic province and travel outside of Atlantic Canada after June 30th, you will need to complete the online safe check-in form to enter Nova Scotia like all other Canadians, and your quarantine will depend on your vaccine status and testing. Also, effective immediately, we are removing the requirement to quarantine upon entry until having a negative test for anyone who is fully vaccinated with 2 doses. So that means New Brunswickers who are fully vaccinated and have at least 14 days after their 2nd dose before entering Nova Scotia are welcome here with no restrictions, and that starts today. This change will also apply to the rest of Canada when we further open our borders on June the 30th. This slight change aligns us closely with the recently announced federal government requirements for Canadians who are abroad and returning to Canada as of July the 6th. We all want to go back to normal. We all want fewer restrictions and more travel, but none of us wants to get more people sick. Public health decisions are about balancing risks. Whether you support our decisions or not, I ask you to consider how much risk you're willing to accept for yourself, your family, and your community. Every step towards reopening carries some risk. It's our job to determine how much risk to take for Nova Scotians. It's tough, and we don't always get it exactly right. And that's why we are adjusting the restrictions in place for New Brunswick. It's also why it is so important that we continue to follow restrictions and get tested. If the virus is here, we need to find it, isolate it, and stop it from spreading. The Delta variant is real, and one dose does not provide adequate protection. Other provinces are still reporting double-digit cases daily, and the Yukon has had a 100-case surge this week, and my understanding that it's from the Delta variant. We do not want that. The more vaccine we get in arms, the more risk we can accept. But our reopening progress must be careful and steady. As of today, 71.9% of all Nova Scotians have at least 1 dose of vaccine. That's good, but it needs to be better. If you haven't had your vaccine, it's never too late. I'm hearing that some people feel they don't need to get the vaccine because we're almost at 75%. They think that they are protected if everyone else is by vaccination. And it's true that when most people around you are vaccinated, it reduces your own risk of getting the virus. But if you're unimmunized and you do get COVID-19, others having the vaccine won't help you from the risk of severe illness. In addition, getting the vaccine not only protects you, it will also protect your loved ones, friends, neighbors, and community members who may not be able to get the vaccine. 75% is our minimum target, but I'd like that to be much higher so we can get the very best level of protection. So please go get your first dose and then follow up with your second. And right now, 13.4% of Nova Scotians are fully vaccinated with 2 doses. And our second dose coverage is increasing quickly. That will continue as we work to get the 400,000 doses into arms over the next 3 to 4 weeks. We can reach our target of 75% of our population being fully vaccinated, and that's a minimum target, by the end of August. But that depends ultimately on Nova Scotians continuing to get their vaccine. Once we do, our province will be one of the safest places in the world. And again, I acknowledge how hard this pandemic has been for many Nova Scotians. But I am troubled by the past 48 hours. We have come this far by caring for one another, showing compassion and positivity, trusting science and good judgment, and being patient and resilient. Once again, I ask you to trust the Premier, myself, and the many skilled people giving advice, and lock arms virtually and get to the finish line, but let's get there together. Following restrictions, getting tested and getting vaccinated, and showing you how much you care about the health and safety of your loved ones and your fellow Nova Scotians. That's how we get through the next few weeks.
Thank you, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters in the room and then on the phone in the allotted time that we have for today's briefing. We'll start with Tim Bousquet from the Halifax Examiner.
Good afternoon. Thanks for the explanation. There's been a lot of confusion about what happens on June 30th and what the target is. My question to you is, our phased approach was you wait 2 weeks, give it the 2 weeks, see what happens, and then you go another 2 weeks. You just said it's 2 weeks. June 30th will be 2 weeks from when New Brunswick opened up their border, but nothing's happened by June 30th, if you follow what I mean. Shouldn't we go 2 weeks after that date and then to see what happens?
No, New Brunswick opened their border on June the 16th. So by going to the 30th, we've waited that 2 week period to say, well, what has been the impact? So New Brunswick made a decision that you can come into New Brunswick with 1 dose of vaccine and you don't have to quarantine. I don't believe that's sufficient to protect against the Delta variant. So what we're watching is what has been the impact of New Brunswick on that decision, and that gives the 30th will give us 2 weeks to observe that impact in New Brunswick.
Go ahead, Tim.
Okay. The take-up on second dose has been really quite remarkable. Watching it, the numbers come in, but it doesn't appear that the people getting their first shot is increasing as rapidly as it had been. Is that just we're hitting diminishing returns for that, or what's going on there?
Well, it's like anything. You get those most willing. It's the last 20 to 25% are always going to be the hardest. So that was in my remarks. We still have work to do. We can't be satisfied just because we're getting close to or when we get to the 75%. That still means 25% of people, many of whom can get vaccinated, are still unimmunized. We have a lot more work to do. It'll take more effort and more time to get that last piece. Some of the things we're putting in place. The walk-in clinic starting next Tuesday at the Convention Center, that is for people for first dose. So we're really encouraged. We're hearing already signs that we're talking with the universities that many of the foreign students we have here, who are part of our demographic, that they're looking for an opportunity to get immunized, and so they feel that this walk-in clinic is going to help them. We are working in some of our large employers like Michelin to actually have immunization clinics in the workplace, because the group that we're most concerned about is the male 16 to 30-year-olds. So let's bring the vaccine to them in those workplaces, and hopefully they'll get vaccinated, and then their friends, their co-workers will also be encouraged by that. So yes, we have more work to do. It's very natural that this last 20-25% when we hit that slows down, but that's why we're going to keep pushing out. We can't be satisfied with 75%. At the same time, we're rolling out many opportunities for people to get their second dose as well. So we still have work to do. Nova Scotians still need to show up and get vaccinated, whether it's their first dose or second dose.
Next, we'll go to Lindsay Armstrong from the Coast.
Thank you. Hi, Premier. I'm wondering what details you can tell us about your conversations yesterday with Premier Higgs.
Yeah, there's nothing else to share that I haven't already said publicly. He was willing to share information, so Dr. Strang and I have that information about their border protection. We still want that full 2-week period from when they opened up, but I think that we all respect the different opinions on the opening plan. I just spoke with them before the briefing to let them know where we landed on the 30th, and I think it's a positive thing that we'll be able to welcome New Brunswickers without that modified isolation at that time. And again, today I think is an opportunity for clarity that if Nova Scotians go to New Brunswick and they come back on, say, Sunday, which I think is the 27th, they're in isolation for 3 days. So on June 30th, it stops. So I think that's not too much to ask. I think it's reasonable, but at the end of the day, some premiers won't agree on a united front for the region.
Go ahead, Lindsay, with your follow-up.
Thank you for that information. I'm wondering if you think that perhaps if you had been able to get in contact and have that conversation earlier on, do you think that would have avoided some of the tensions that led to the blockade?
The blockade was organized by an opposition MLA and people that were upset. I don't think it's appropriate at all to blatantly break the law in this province. But I continue to have conversations with the premiers. We've had many conversations over this period of time. I don't think that they would have, we asked if they would wait till July 1st. They said no, that's their decision to make.
Next, we'll go to Madeleine Bizot from allnovascotia.com.
Good afternoon. This question's for Premier Rankin. Since the Tuesday announcement with the New Brunswick modified border, we've heard from a lot of businesses that have been swarmed with cancellations of their services. So I'm wondering, are you planning on rolling out more support for these types of businesses, or?
Well, the package that amounts to $18 million is a significant boost to especially the accommodation sector that we're helping. Marketing plans, we worked with the sector to see how we could best support them. We're trying to avoid another shutdown. That's good economic policy too. We need that second dose coverage that Dr. Strang and Public Health has been asking for. We're 6 days away from that 2-week period that we've talked about many times and talked about again today. But I recognize that it's a bit of a challenge to wait a little bit longer, and I just ask for their patience, and the government will continue to support them.
Go ahead with your follow-up.
And this question's for Dr. Strang. Just looking for some clarification here. So Dr. Russell said yesterday at the press conference that their decision to open earlier to Canada was based on science. Newfoundland opened to New Brunswick earlier, said based on science. So I'm wondering what specifically is different with Nova Scotia. Are you looking at a different medical study on why we seem to be a slow jurisdiction in Canada for reopening?
We're looking at the same science. It's a matter of risk tolerance and our experience. First of all, that a slow, cautious reopening has stood us in good stead. And actually, when you look at even economic recovery, that slow, cautious approach, longer term, creates good economic recovery. The fundamental issue, I guess, is Dr. Russell and I disagree. I feel that because of the Delta variant and the need for 2 doses of vaccine to give you good protection, that to open up and to other parts of the country where there's much higher risk of somebody bringing in the Delta variant, without having good two-dose coverage in our province, we feel was too much risk for Nova Scotia to take on. New Brunswick made a different risk calculation. That's their choice and their ability to do that.
We'll go to the phone lines now. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. Picking up on that, I'm wondering if you could maybe even more articulate what the risk would be to Nova Scotia of opening, let's say, tomorrow with the changes that you've just announced.
Well, the risk is that I believe we do not yet have sufficient numbers of Nova Scotians, especially those 65 and above, with 2 doses of vaccine. When we understand that it's the Delta variant, which is a key, which is out there, and that the risk is when you open up, that's the variant that's going to come in and has the biggest potential to spread and cause a resurgence and possibly have to put on further restrictions and create severe disease and increase hospitalizations again, simply because we know that a single dose, we got good coverage with a first dose, but a 1 dose of vaccine only provides at best modest protection against the Delta variant. You need 2 doses of protection. So I'll stand firm from a public health perspective that you're taking on risk by allowing people to come in without isolation, because the isolation is what is the other layer of protection. And if you remove that, you really have no other layers of protection. So we need to keep solid with our borders while we build our own internal protection, if you will, by having sufficient levels of uptake of the 2 doses, the second dose of vaccine, especially for those who are at higher risk, the 65. So by the time we get to next Wednesday and the 30th, and then in the next few days in July, we're having rapid increases in our coverage rates for this 65 and above. So it puts us in a position on the 30th to be able to take on that extra layer of risk by opening up to New Brunswick without any quarantine requirements.
Go ahead, Keith, with your follow-up.
So then, what do you make then of their daily case numbers to date, given that they opened up over a week ago now, and we haven't seen a spike in numbers? If anything, the numbers have been at least as low, if not lower, than Nova Scotia's.
So I'm pleased that they're not seeing the impact, but it's early days yet. But also, this is about risk. Just because nothing happens, you may get lucky. You may take a risk and nothing happens to you. The next time you take a risk, something bad may happen. So this is all about risk calculation. And in Nova Scotia, we've always taken a cautious approach. And if you look back over the last 16 months, that cautious approach has stood us well. We're being looked at in recent national and even international media, looking at Nova Scotia as a model of success about how you handle the pandemic.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, just wanted to go back to the restrictions being used for New Brunswick travelers. When exactly was that decision made to remove restrictions for travelers coming from New Brunswick on June 30th? I think at the last update, it was still being looked at, so I'm just wondering exactly what changed to lead to the decision today.
Yeah, that was always the plan, to aim for June 30th. That was the 2-week period that we were asking for. So ever since that briefing, I was saying to every I think interview that I've had, let's give public health that 1 week. So we were looking at if we could remove all isolation requirements by June 30th, New Brunswick would enter into the so-called bubble, but it's not really a full bubble anymore. So I just like to say it's isolation being removed, and so we're pleased to be able to bring this forward for full certainty that on June 30th, for sure, there are no restrictions. We talked about potentially having some documentation at the border, but we're comfortable with where we are now. But we all have to look at what's happening at different levels in each province. So we could modify that again if there's a surge in cases in New Brunswick or another province. We have to give that flexibility to our teams.
Go ahead with your follow-up, Natasha.
Thank you. That was sort of my next question, actually. Nova Scotia is obviously doing really well. We're seeing few cases each day, or some days none. But would you hesitate to shut things back down again if, when we do open up on June 30th, there is a surge in cases in the province?
Well, I really hope that's not the case. Nobody wants to see that, and that underscores the importance of our cautious reopening plan and those 2-week separations between our phases. So we seem to be on track for next phase starting June 30th. Second doses, it's really important for Nova Scotians to get out and get their second dose. Those are mitigating factors to prevent another shutdown and continue to get tested. And follow these public health restrictions. These are the 3-pillared approaches that have been working for us throughout the pandemic, and so I have confidence in Nova Scotians. The vast majority of Nova Scotians will do the work as they have in previous waves, and we got through that third wave, as Dr. Strang just said, in record time, and that's being recognized. I firmly believe these are the right restrictions, and that's why we need to be patient, cautious, but deliberate with our reopening plan.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Thanks, Tina. My question is for Dr. Strang. I'm twigging to the phrase you used, that you were very troubled for what's happened in the past 48 hours. Given the fact that the vast majority of Nova Scotians are adhering to the rules, what is it about what happened, I guess, at the border that has troubled you so much? Does it speak to something larger?
I think to me it was well, the troubling piece is because seeing some fragmentation. when I talk a lot. I've been doing more presentations to people outside of Nova Scotia on the success of Nova Scotia's approach to the pandemic. I always talk about one of the key things is that Nova Scotians have from the very beginning committed to each other. We can put all the restrictions and all the requirements in place, but if people aren't committing to each other, following things because it's the right thing to do for everybody else in their community and looking after each other, none of this would work. And so I was troubled by the signs of some fragmentation, and I get it that people are tired and fed up, but we need to stick together for a few more weeks. And so that fragmentation was what really was troubling me. We can't afford that. We get through this by getting through it by caring for each other, looking after each other collectively as Nova Scotia together.
Go ahead, John, with your follow-up.
Yeah, and this is a more technical question for you, Dr. Strang. We heard from somebody who is a snowbird who went to Arizona, and I can't imagine they're alone. When they called public health to say, look, I'd like to register the fact that I've had my 2 vaccines outside Nova Scotia, they were told that there was really no way to do that yet. And so I'm wondering what is in place or what will be put in place to register the fact that Nova Scotians coming home from elsewhere will be able to register the fact that they've had 2 vaccines and be counted.
Yeah, we're asking, people the direction is people can phone their local public health office, provide their information, and we're working on ways about, how we can then ultimately get that as part of our electronic database. But we've had lots of priorities in terms of where our folks on the digital IT side have been working. This is one that hasn't risen to the top, but we are saying to people, if you want to have your information and to become ultimately become part of our vaccination database, then you certainly can provide that to local public health.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thank you. I'd just like to get some clarification on the 30th because I'm hearing a little bit of mixed messaging. You're saying that we're waiting till the 30th because that'll be 2 full weeks since New Brunswick opened, which makes sense. But then, Premier Rankin, you had just said that you are fully certain that we will open completely to New Brunswickers on June 30th. How can you be sure that we'll open if we're waiting 2 weeks to kind of see what happens?
Well, I would not agree that we're fully certain. That we're not fully certain of anything when it comes to the pandemic and seeing if there's a surge in cases in between then and now. We have to give flexibility to be able to adapt. That's the thing about this. We need to have the ability to make live decisions when we see things happening. But the plan is that we will I think it's pretty clear that on June 30th, all isolation requirements drop for New Brunswick, and people who have driven to New Brunswick from Nova Scotia and back. So it's essentially a countdown from today of 6 days. If you're going for a day trip in between now and then, and you come back, you have those isolation requirements that we announced last week. And so if you, but then it runs out on June 30th. So the closer you get to June 30th, then you have less and less isolation. So by the time you leave on June 30th and you come back, there's no isolation requirements. I think that's pretty straightforward, but we still have to give flexibility. I have full confidence we'll get there, but it's hard to say that anything with this pandemic is fully for certain.
Go ahead, Alicia, with your follow-up.
And now that we are opening up and allowing more freedoms, particularly for those individuals who are fully vaccinated, I'm just wondering why not open up second doses, to anyone who's had their first dose for at least 28 days, maybe allow people who are maybe more anxious to get their second dose a chance to get it sooner, or who are looking to, see family outside of Atlantic Canada who haven't been able to, why make, particularly the younger age groups wait till potentially August, whereas other people have that freedom starting July 5th, I guess.
So you can't just throw it open to everybody. We have a certain amount of vaccine, and this is the one of the success points in Nova Scotia. We have a very tightly managed system. We know exactly how much vaccine we have, where those doses are. We invite people in for appointments, and we're doing it based on age, and we're going down by age to make their appointment. And twice a day, there's a team that looks at the matching appointments and the availability, and then when we're ready to open up to the next group. So we have about 100,000 people left to be invited for their second dose. That's happening. I'm not sure if it happened today. If it didn't today, it'll be tomorrow. About half of those, the people who were immunized in the latter part of May, and then early next week we'll be opening up for the other roughly 50,000 people who were immunized in the first couple of weeks of June. So everything we've done is in a very organized, systematic, planned manner, and that way we can track exactly where we are, and we're looking at things by a very local level, by age groups, and looking at where we need to apply more effort. Most other provinces don't have that, and that's what they're doing. They just throw the doors wide open. They may look good initially, but we have the organized, systematic program which will get us to the front with second dose, just like it's gotten us to the front with first dose.
Next, we'll go to Adrian Blanc from Radio Canada. Go ahead, Adrian.
Thank you. Dr. Strang, how will the province be able to check people's vaccination status? Like, what will constitute a good and reliable proof of vaccination?
So every province is providing people, some of it's in paper forms, others it's electronic records. What we say, and so now today, people coming from New Brunswick. On the 30th, it'll be people coming from outside of Atlantic Canada. They have to log into our Safe Check-in registration. They have to upload their proof of vaccination that's given to them from their province. They also have to bring that with them when they come in, whether it's by air or by land, because they may well get asked to actually provide that proof of vaccination a second time by one of our border officials. So again, two-step. They have to upload it and then bring some copy, whether it's electronic on their phone or an actual paper copy that we'll be monitoring and checking those.
Go ahead, Adrian, with your follow-up.
Premier Rankin, looking back on the past few days, do you think you could have done something different to avoid the blockades we saw?
No, we're going to continue to make decisions based on the best available science that we have and work together and bring out the proposals. I continue to listen to the advice of the public health team, and we need to sometimes have courage to make decisions that aren't always popular with some groups of people, and there was varying opinions that I've heard at the border. It wasn't just about the restriction. There were anti-vaxxers and other groups at that border. I don't think it was appropriate at all, but I'm glad that it's peacefully resolved.
Next, we'll go to Nusha Siafati from the Chronicle Herald. Go ahead.
Thank you. Good afternoon. What message do you have for those who participated in the blockade protest?
I think I just addressed that. I like to have an optimistic outlook, and I think that it's a positive thing that we're getting ready on schedule for our Phase 3 next week. We're in good shape. I ask all Nova Scotians to be kind to one another. It's the Nova Scotian way to look out for your neighbor, and let's help our reopening, help our businesses, and continue to support your province.
Go ahead with your follow-up.
And do you have any concerns that a number of vocal anti-vaxxers participated in the protest?
Well, I think that at the end of the day, we have to have faith that most Nova Scotians do not think that way. And we have over 70% of our population and growing that has already had one vaccine. We know vaccines work. The numbers don't lie. I'm going to continue to remain optimistic that with our leading vaccine uptake in nationally, I think that we're in really good shape, and I'm optimistic that we'll get through our reopening as planned, and that we'll start to lead the country in our economic recovery.
Next, we'll go to Daryl Cole from the Amherst News. Go ahead, Daryl.
Thank you, Mr. Premier. My question is in regards to the blockade that ended yesterday. I wondered, one of the things I kept hearing was people are upset that they're not being listened to. And I guess now the blockade is over and we have 6 days go to the border opens. Is there any way that you can reconcile or try to reassure people here that their thoughts and concerns are being listened to?
Well, there are the ones that have families that they haven't seen in a long time. I think it's a lot of Nova Scotians and New Brunswickers have those connections, and I can certainly appreciate it. It's in my family. I think it's in most. Parts of my family can't go see their siblings in New Brunswick. This isn't about just the border towns. This is much deeper than that. So all of us want to see our borders relaxed, but we're not prepared to do that until we have full confidence that it's safe to do so. 6 more days. That's my message to those people. I definitely hear you, but we need to continue to stay focused.
Go ahead, Daryl, with your follow-up.
I guess I just asked a question about this morning's announcement that Elizabeth Smith-McCrossan is no longer in the PC caucus. So I'd like to get your thoughts on that, Mr. Premier.
That's an issue between Mr. Houston and that member of the legislature. I'm glad that Tim has finally backtracked on his support for her actions.
That's all the time we have for questions today. Go ahead, Premier.
Thank you. So 5 cases today, and just yesterday we had 0 cases. Think about that. In every single zone in our province, we reported 0 cases. Now that can change in an instant, and we can't let our guard down. But we do need to take a moment to celebrate our success. Just a few short weeks ago, we were reporting triple digits. Through your hard work and sacrifice, we are down to single digits being reported and have reduced community spread. And I am grateful, and Dr. Strang is grateful. We can now talk with certainty about reopening and reuniting. I know for some, our approach is too slow, and not everyone is happy. But we are in a better position because we have listened to public health advice. We are in a better position because of a strong vaccine program. And we are in a better position because of all of you. I'm so proud of this province. When things got bad, you got to work. You continued to follow public health protocols. You followed the restrictions even when you didn't want to. You did all of that to protect one another. And this past 24 hours were difficult to watch. People facing off and yelling at one another. And the stress of COVID is a lot to manage. I understand that. I know you're tired and fed up, but I'm asking you to hang in just for a little longer. June 30th is less than a week away. And as you count the days, I think we can all feel fortunate to be where we are today because of such a strong public health team. We live in the greatest province in the country. Our oceans are vast, our scenery is second to none, and above all, our best asset is our people. I couldn't be more optimistic about the future of this province. So stay hold, keep that optimistic nature, and be kind to your neighbors. Thank you.